Hi everyone, so today we're going to talk a little bit about some of the common mistakes that we tend to make when it comes on to, the NCLEX. I don't know how many persons have been into an exam. I would feel as though we did well on the exam, but only realize that some of the questions we think we didn't know the answer, but only end up on getting them wrong. We get them incorrect. So we're going to go ahead and try to see what the common mistakes are and how we can fix them. So the first thing is that, when it comes on to the NCLEX, a lot of us are not reading the questions in its entirety. We're not reading the questions carefully. So what we tend to do is we tend to skip out or we skim over certain words like priority, first, needs further teaching, things like those. We tend to avoid them or we skim over them and we don't read through the question properly to understand what the question is asking. And so what happens is that, we tend to misinterpret what the question is asking and get it incorrectly. So how we can go about correcting that is make sure that we're slowing down, we are circling, highlighting, the key words, and ask yourself, what is the question really asking? And then from there, you answer the question. The second thing is that we tend to ignore Maslow's hierarchy of needs and the ABCs, airway, breathing, and circulation. Sometimes we find ourselves picking what sounds right and not what is correct, what is important or most important for the patient. Especially when you have experience, a lot of times we might be doing certain things in the real world and we think that it's correct or it sounds good to the ear and it sounds like it's something that, is accurate for us in the exam. But no, remember, use the Maslow hierarchy of needs and focus on airway, breathing, circulation. You understand? Go back to prioritization and use that to answer your question. A lot of times we tend to be studying from different contents and we're not using or utilizing study questions. So the questions are there that are going to help with, providing you with a guideline or have an outline of how the exam will be set up. So use it to answer some of the questions as you go along. You understand? Don't sit down and study all day reading the textbook and don't have an idea of how questions are set up and how, in terms of the wording, the words that they're used, the keywords that they're using in the exam. You don't have an idea of how the exam is set up. So definitely go ahead and use question banks. You understand? Go ahead and download, UWorld, Archer, Simple Nursing, things like those, and apply, your knowledge to how the questions are set up, the NCLEX type questions that are set up, and answer them as you go along. A lot of times you might be finding yourself spending a lot of time on one question. Do not do that. Go ahead and try to make sure that you're setting a time period on each question. So if it means that you're going to say 60 seconds you're spending on one question or 1 minute, that is what you're spending on it. If you realize that you're there and you're not so sure about the answer, you can always flag the question and come back to it. And then from there, but you don't want it to be a case where you're spending so much time on one question, time run out, and then you fail the exam. All right, the other thing is you tend to change your answer without having a good reason. A lot of times we tend to be going back and forth with the questions and say, oh yeah, probably this one. If you don't have a good reason as to why the answer is this, let it stay at your initial answer. A lot of times if you can go with your gut feeling is telling you that it is A, it is A. So try not to be doing, this constant changing of answer if you don't have a valid reason as to why the answer that you're choosing or second guessing is the correct one. All right, so unless you find out some new information or something like that, just leave it as is. The other thing is that you might not know how to answer the select all that apply questions, and so when you get into the answer, you might be there overthinking, you might be there spending a lot of time on the question. So one thing I would suggest is that you go ahead and treat each answer as a yes or no, a true or a false. You understand? It's either it goes so or it no go so. And then from there, you can use the process of elimination to answer your question. So if you realize that it doesn't fit the criteria, then you go ahead and choose the answer based on that. All right, and that's how you go about with answering your select all that apply question. Sometimes when it comes on to pharmacology, a lot of us tend to be very weak in it, and so what we tend to do is try to eliminate or ignore the questions when it comes on to pharmacology. No, you need to answer the questions. You understand? You need to definitely answer the questions when it comes on to pharmacology. So the only thing you can do is focus on the different drug classes and the common side effects for these. And then from there, at least you'll have a basic idea when it comes on to answering some of those questions. Another thing is that a lot of us are studying, but we're not reviewing the rationals. Even though the rationals are there, we are ignoring them. And even if you get the answer correct, it's okay to go ahead, and it is the right thing to go ahead and read the rationale and get an understanding to make sure that whatever the person who is providing that content or the answer, whatever they're saying, it's something that matches up with what you're thinking in terms of why you choose that answer. So always go ahead, even if you get it right, read through the answer, read through the rationale, and make sure you have a better understanding. Because sometimes when you read the rationale, it clears a few things that you had in your mind that you weren't so sure about. So definitely do not skip over your rationales. Practice studying with your answers and your rationales, and at least you will broaden your knowledge a little bit more on the content that you're reading. Another thing is that a lot of us tend to cram before the exam. Try not to cram before the exam. If you never get the information a couple months from before, do not sit up the whole night before the exam and try to cram all that information. Stop studying the night of the exam. Go ahead and rest, relax yourself, hydrate yourself, and prepare yourself. Put your body in a frame of mind for testing for the next day. But do not cram before the night of the exam. The other thing is that, a lot of us, we're not managing our anxiety so well, because as soon as we get closer to the exam date, we tend to find ourselves, getting confused, flustered, we become overwhelmed. Sometimes we find ourselves freezing up when we're trying to answer the question. We become brain fog. No, let us start from early to try and manage anxiety. When it comes on to breathing exercise, let us go ahead and try to do that. Talk ourselves through certain situations, because when you get into the exam, when you're feeling so stressed on the day, you don't want it to be a case where you're feeling so anxious and you're not able to complete the exam. You want it to be a case where you're feeling anxious, but you can talk yourself out of it. You can deep breathe yourself out of that anxiety and just tell yourself that you've prepared for this and this is the day that you've been waiting for, and you're going to be doing well. And hopefully with these tips, it will help you to prepare yourself a little bit better and will come out with the pass or the grade that you're looking for in your NCLEX whenever you go and sit that exam. So I do hope that these tips were very beneficial for you. If so, go ahead, give me a thumbs up, a like, a share. And remember to go ahead and follow me here on TikTok as well as on YouTube at Think Nursing. And if you feel as though this content, is something that will benefit another person, go ahead and favorite it. Go ahead and repost it. You understand? And check out the other content on the page. Until then, I will see you in the next video. Bye.